Hello everyone, my name is Ahmed, and today we'll be talking about chronic patellar tendinopathy in novice to intermediate powerlifters. So to begin with, a little bit about the context of the program that we're going to be talking about. We'll begin off with sporting context, moving into some sporting demands, being in training and also competition. Then we'll be talking a little bit about the epidemiology of injuries and mechanisms, and also some of the known preventative measures in powerlifting, followed by a proposed protocol considering reasons and modifications as well as level of intervention, and then finalized by barriers to the protocol and implementation, which will be talking about barriers and also the guidelines of our essential program. In regards to sporting context of powerlifting, there's no significant difference in injury rates between male and female powerlifters, and male and female powerlifters train in the same programs and compete in the same context. As such, we won't be differentiating between male and females in our proposed protocol. However, we will be specifically targeting novice to intermediate powerlifters, and this differentiation between novice, intermediate, and elite are dependent on weight class, skill, and performance, as our approach will be targeting specifically novice to intermediate. Powerlifting in regards to training demands is done in a very controlled environment where there is little to almost no external stressors. So majority of the time you don't really expect to get tackled while performing a deadlift in a training session. So a lot of this training is relatively individualistic, so you'll be performing individual lifts in a very controlled environment. Most of these lifts in powerlifting are termed progressive overloading in regards to bench press, squat, and deadlift, which we will talk about in a second. Most of these exercises, the whole purpose and goal is to lift as much weight as you can. So progressively increasing the amount of weight you do is beneficial. A lot of these exercises are very fatiguing and they require lots of repetition and chronic movements, which we will also be talking about later on in the presentation. So talking a little bit about the competition demands of powerlifting. Powerlifting is dedicated to three major lifts as described earlier: the bench press, the squat, and the deadlift. Each powerlifter will have 3 attempts at lifting as much weight as possible in these 3 attempts. So majority of people will start off a little bit lower and progressively increase the amount of weight they do for each attempt, with the end goal being that the final lift being the greatest amount that they can lift. So a little bit about the background and history of injury in powerlifting is in regard to the repetitive nature of this sport. So as mentioned before, a lot of the exercises and training are very repetitive, and as such, the injury rates tend to show a lot more chronic injuries, with chronic injuries in powerlifting going up to around 65, if not more, of total injuries of powerlifting, and only about 15 to 20% of injuries being acute, and the other 15 to 20 being actually uncategorized. In regards to the mechanisms of injuries, there are 3 main mechanisms of injury in powerlifting, one being tendinopathies, which is the greatest mechanism, second being muscle pulls, and third being cramps. A lot of the current preventative measures in powerlifting include something like extensive warm-up in order to reduce cramps and muscle pulls, as well as form and technique perfection. So a lot of athletes will actually devote a lot of time in perfecting their technique, as well as diet and supplementations. This can go into something like creatine, making sure you're in a nutritious diet, making sure you're in a calorie surplus, as well as lifting in regards to technique, making sure that's perfect. A lot of the injury prevention measures are also in regards to equipment, such as wrist wraps, shoulder wraps, knee wraps, and back wraps, such as belts. So, as you saw in the previous slide, the greatest injury incidence in novice to intermediate powerlifters is in the knee, and the greatest mechanism of injury in novice to intermediate powerlifters is tendinopathies. So a great target for injury prevention would be patellar tendinopathy injuries, which are found to be quite significant in powerlifting. Patellar tendinopathies are generally due to degeneration of the patellar tendon, which you can see in the photos above. Both anterior and lateral views of the patellar tendon, which are attached to the tibial tubercle in your tibia and your quadricep muscle. Patellar tendinopathy causes pain and reduces performance. Although it is not a very severe injury, it can take a very significant amount of time to heal. So reducing performance is not ideal, especially in performance settings. So the decided protocol in terms of reducing injury or injury prevention for patellar tendinopathy would be unilateral muscle training in powerlifting. So a little bit about the reasoning and mechanism behind why unilateral muscle training helps prevent patellar tendinopathies is that it is found that imbalances in muscle strength and tendon stiffness lead to these tendinopathies. So in regards to a lot of the movements that powerlifters do, they are compound exercises that, such as the bench press, squat, and deadlifts, and in other terms, these powerlifters may actually compensate with other muscles that are maybe lacking and need to be addressed, and this can be done through unilateral training. So inputting these unilateral training modules and mechanisms, you will be able to find these imbalances and potentially train these lacking muscle groups, which will decrease imbalances and thus decrease patellar tendinopathies. So these, it is also found that unilateral muscle tightness or weakness further leads to imbalances and compensations, as we just mentioned. So furthermore, other research finds that mobilization increases collagen synthesis. So we know that in regards to powerlifting, squat, bench press, deadlifts, they use very compound movements. So these mobilizations can be basically hidden in these compound movements. For example, once you're squatting, if you have maybe a weakness in your hamstrings, you tend to overcompensate with glutes or other sort of muscles, which can actually further lead to these imbalances and then further lead to tendinopathies. Furthermore, we found that 0 to 60 degree mobilizations and exercises target mainly the anterior knee, and again the anterior knee, which is part of the patellar tendon. So in these unilateral muscle trainings, we have to be targeting angles of 0 to 60 degrees in order to increase mobilization, which then increases collagen synthesis, which then reduces patellar tendinopathies. So I have a little diagram on the left here showing where 0 to 60 degrees is. So exercises such as quadricep extensions, quad extensions, and a few other ones which we'll be talking about later on. And further on, speaking about these imbalances, researchers find that many of these imbalances are much more prevalent in novice lifters. So targeting these novice lifters early on in order to reduce these imbalances will then hopefully reduce chronic injuries later on in their professional career. So in regards to the actual mechanistic modifications to the training and the actual protocol, we will be implementing this unilateral muscle training as mentioned above to reduce strength imbalances between legs and essentially the quadricep muscles, which are actually attached to the patellar tendon. So reducing these imbalances will then reduce this imbalanced degeneration of the patellar tendon, which then leads to patellar tendinopathies. So the training modification should take place 2 to 3 times a week, and specifically 2 to 3 times a week, as has been shown in rehab settings to have the greatest mode for collagen resynthesis. And since tendinopathies are degeneration, ensuring synthesis or resynthesis recovery is key. Furthermore, the training will incorporate loads of about 85 to 90% of 1 RM, so pretty heavy loads. However, powerlifters are generally accustomed to lifting at around that load, and since these loads will be pretty accustomed and although heavy, heavy loads have actually been shown to increase tendon adaptations. And finally, looking back at the specific range of motion, as we mentioned in the previous slide, incorporating these exercises like single leg box sit to stand or leg extensions that are targeted for 0 to 60 degrees. We'll focus on generally the anterior knee and more specifically the patellar tendon, and then increase mobility through those exercises. So the level of the intervention will be a more coaching level of intervention as the change in coaching routine, thus leading in greater focus of unilateral strength and interventions. This whole thing encapsulates the training modules and training modifications. So it will be at the level of the coach in regards to intervention. So the coach will obviously need to ensure importance of equilateral strength and making sure that there is little to no imbalances in strength, which will then help reduce the uneven degeneration of the tendons. And this is both in regards to injury reduction as well as athlete longevity. So now we can talk about the implementation and some of the barriers involved with implementing this sort of protocol. So the first barrier would be time constraints. So as powerlifters, making sure you're making use of the time as efficiently as possible will be a barrier. And since these exercises are unilateral, they consume a lot more time as you're working each leg independently. So a proposed solution is that placing these unilateral training post a major lift will be more effective, as you're not really affecting the major lift as opposed to supplementing it with other strength improvements as you're working in a strength zone being 85 to 90% of 1RM. Another barrier could be that powerlifters don't compete in any unilateral lifts, so why do we need to practice them? So a little bit about maybe an athlete reluctancy. So a proposed solution would be informing them that research has shown that increased unilateral strength can help with stability in major lifts. So this can actually, although indirectly, as you're working unilateral, it is directly affecting your major lifts and some of the balance and stability that is involved with it. So a third and final barrier that was brought up was potentially that majority of powerlifting gyms don't actually have all these excess or extra machines. So they might not have access to a quad extension machine in a powerlifting gym. So their proposed solution would that there is alternative equipment, such as using free weights and single leg squat to sit, which still targets around that 0 to 60 degree range that targets the anterior knee. And you can also use these unilateral. So it will be working out the same muscles and identifying similar imbalances. So now we can finally talk about what kind of information is being reported and how often. So in regards to this is a training modifications, a lot of the information that we're going to be reporting is based on the training. So reporting will be done in terms of weight, either pounds or kilos, how much is either each leg lifting, and how much repetitions can each leg do. And these are more objective measures. So adding a subjective measure such as discomfort level in terms of RPE will add a little bit more complexity and nuance in order to find out if there is truly an imbalance and then rectify it. So using RPE will be the subjective measure. In terms of frequency and format, you'll be reporting bi-weekly, although the training should be done 2 to 3 times a week. Having too much frequency in your reporting may lead to too much data being brought up. So having a little bit of time for these imbalances to pop up, such as biweekly, will add more ease to read and less data plotting. Furthermore, you'll be reporting data numbers such as pounds and repetitions, and it will be graphed for visualization. And then, of course, RPE will be involved in that as well in terms of the graphs. So, below here is a graph that shows differences in strength. And as you can see, the red line being a right leg and left line, and the blue line being the left leg, there is an evident discrepancy in strength there. So going into further protocol to rectify this would be important. So finally, we can actually start talking about the guidelines and wrapping it up in regards to our protocol. So basically, we will be working at 85 to 90% of 1RM, and this is, of course, for greatest tendon adaptations. We will be using 2 to 3 sets per leg, and this is for, and then, of course, further training if imbalances are presented in the same type of protocol using these unilateral strength trains to to decrease the imbalances present. So if there is imbalances being noticed, maybe increasing the amount of repetitions or sets you do of unilateral training will help rectify this. And of course, 2 to 3 sessions a week for greatest results and reporting bi-weekly. Again, thank you all for listening and hope to see you in the question section.